Hello and welcome to the 48th Annual White Marlin Open. I'm Dr. Mark Edney, a urologist with Chesapeake Urology Associates, the leading provider of urologic care on the southern Delmarva Peninsula. And I'm very excited to have with me today Dr. Alyssa Gracely, who is going to be joining our practice this summer. And very excited to introduce you to her and talk about what she's going to be able to offer to our patients and to the region. Dr. Gracely, so nice to have you here. We are so excited to have you join our practice. You are finishing a fellowship in female pelvic medicine and reconstructive surgery at the University of Michigan, one of the nation's top training places for urologic surgeons. And so we're so excited to have you. Let me start by asking you, what attracted you to the region and to our practice?
Truthfully, I knew very little about Salisbury and the lower Delmarva Peninsula when I first heard about Chesapeake Urology Associates. However, coming from Charleston, South Carolina, my husband and I were super eager to get back to the East Coast. Love the water, love fishing. He's so into that and was really just, let's check this out and see what this opportunity has to offer us. And one visit was all it took. We were sold. We were attracted, of course, to the amazing area, but really truly to the practice itself. I was just so impressed with the integrity and pride with which you all practice urology, and really felt like I could fit in and that my specific skill set would be needed. And that's really what we were looking for. The fresh seafood and the coastal lifestyle, added bonus.
Absolutely. Totally agree. The Southern Peninsula is an extremely special place, and we all love living here, and we can't wait for you to join us.
Us too.
Let me talk a little bit about your training. So you're finishing a fellowship. Please explain for folks, how's a fellowship different than a residency, and what kind of training is involved in doing a fellowship?
That's a really excellent question. So any practicing doctor going into their field has to complete a residency. So I did a 5-year residency in urology just as you did. Urology is a relatively broad field, though, and so occasionally the need for specialists exists. We just see too much. And so fellowship is really an excellent opportunity to provide that extra specialized training. So I did a 2-year fellowship in female pelvic medicine and reconstructive surgery, working exclusively with experts in that specific set of problems, so that I had that extra training needed to provide something that is not always available.
That's fantastic. And the word female is right in the name of the fellowship. So it's a focus on female issues in urology. Go into that a little bit. What sorts of issues are you actually getting this specialized training to be able to take care of for women?
So it's amazing how many people are surprised that women need a urologist too. But women have specific pelvic health concerns that are unique to them, just like men do. And that's really where we come in. So the main things I help women address are urinary incontinence, which is leakage of urine, bothersome bladder symptoms such as peeing too often or not having control over their bladder, not being able to urinate, and then pelvic organ prolapse. So that's primarily what my specialty is. These are very sort of intimidating subjects, and a lot of times women don't actually even know what's going on. They just know that something's not right. I love working with women to kind of figure out what is exactly causing their symptoms and then working together to find a way to address those.
You make a great point about sometimes women can have issues and not even be really clear what's going on. They know it's not right, though. Along those lines, I've had, in my experience, in my practice, I've treated women with urinary incontinence. And my experience has been with these women, a lot of them will delay getting care for a long time because it's a deeply personal issue, and a lot of women feel a sense of embarrassment either for leakage issues or the prolapse issues that you talked about. So they'll put it off and they'll chalk it up to, well, this is just a part of getting older. They'll explain it to themselves in a variety of different ways. And they ultimately, when they do come in, they end up being so relieved. Tell me about what your experience has been about, and what would your advice be for women who are watching, who may be suffering silently, as we say, with some of these issues? How would you advise them?
So this is one of the number one reasons that I went into female urology. You're correct. So many women sort of suffer silently for years out of embarrassment or just thinking it's a normal part of aging. I remember this one woman, fantastic teacher, and she had to quit her job because she had such bad bladder control issues and just wasn't able to get the time she needed to address those, the bathroom breaks. And she came to us after she had lost her job, and fortunately we were able to work together, figure out what was going on, figure out a way to fix it, and she's teaching again. But she was so embarrassed by it and just thought it was sort of something that happened that she waited a very long time to get that addressed.
Yeah, and I've had the experience also with men and urinary issues. I often hear once they finally come in and say, hey, this isn't working, and we do a procedure and they're fixed, I hear this comment a lot. They say, I wish I had done that years ago. Do you hear the same thing?
Absolutely. So I didn't treat my aunt, but I remember as a child, we'd go out, have a great time, and she'd giggle that she laughed so hard she peed herself. And this was something that happened often. Laughing, exercising, she would leak. She waited 20 years and handled it with remarkably good grace, but she finally got treated last year and called me a week after and said, oh my gosh, this is the best thing I have ever done for myself. I can't believe I didn't do it sooner.
Sure.
Obviously, I didn't treat my aunt, but I see this happening time and time again with women that I treat as well.
So the message for women watching, if you are having issues along these lines, whether it's incontinence or prolapse issues, you don't need to suffer silently. It's not a normal part of aging, and there are a lot of things that can be done to fix it. And so make that call and come in and see Dr. Gracely, because there are a lot of things that can be done. You are going to be this summer the only fellowship-trained female pelvic medicine and reconstructive surgeon on the Delmarva Peninsula who is a urologist. So I suspect you're going to get very busy very quickly. Tell the audience, what's the philosophy going to be of your practice, and what's your vision for your practice, and what do you want to achieve here?
So I deal primarily in quality of life issues, and there's a really common misconception that because these problems aren't life-threatening, that they're less important. And I'm here to tell you that that is not true. These issues are just as important as any other medical condition and are worthy of being addressed. My intent is to approach each of these issues with the gravitas that they deserve, and to give women a safe space where they can feel like they can come and talk to me even if they're not sure what's going on, and then we can work together to address these problems. The beauty about most female urology conditions is that there are so many different treatment options, and so we can work together to find the one that's right for you. And if it doesn't work, we have other options available.
That's a fantastic overview. Thank you so much for taking time to join me today, and we cannot wait for you to get started this summer.
Thank you for having me.